One of the most important things for the low-grade chronic inflammation, it's the diet that we used to eat for a while, like ultra-processed food, too much carbs, sugar spikes, and pro-inflammatory fats. So what I bringing today to this table, on the table today, is the anti-inflammatory diet. And that's because mixed with bioactive protein, it's excellent, better outcome, and it's a key for the successful in our patients. So even though that's something that it's more new now, and people it's knowing more, in elderly people, the recover, it's making a results can be more significant. So nutrition before and after surgery on stem cells therapy determines the recovery and regenerative outcomes. For me, it's really important to bring this now because healing, we know healing is a complex process, right? And involve inflammation, proliferation, and remodeling the scar. But there's problems in our office when the patient come not with just one thing. They come with several stuff. So the chronic disease can disrupt our process in the office with the patients. So one of the common chronic conditions after healing or affecting the healing is diabetes, hypertension, obesity, metabolic syndromes, smoking or alcohol use, autoimmune disease, and dyslipidemias. And I'm saying this because there is a consequence of have this to fix another thing. So he's going to prolong the inflammation if we are in a chronic low-grade inflammation in our body because of the increase of the pro-inflammatory mediators, limited the cellular proliferation because of the oxidative stress, and alter the tissue remodeling. And this is something that we see, or I saw in my office really often. Because of the disorganized collagen, that means delay the healing, more complication, and poor scar quality. So why anti-inflammatory diets matter for me and to bring in here for you? Unhealthy diet, we are talking about unhealthy diet. It's a lot of sugar. For me, it's sugar, actually. Processed or ultra-processed food, and all the pro-inflammatory fats that it's excess of omega-6 or trans fats. And why that happened? Because it comes with overweight, and the overweight and the fat tissue comes with lipotoxins, and that makes more toxins in the body, more inflammation, and obviously impair the stem cells integration and the collagen production. And always ultra-processed food and additive come with a good permeability, which is, we know that all the immune system, it's behind the gut. So it's always no proactive, it's disorganized. So we, at the end, we are getting the weaker immune system in our body. So emotional eating, anxiety, and depression, it's a topic that it's really important to talk, because when our body is inflamed, the neuroinflammation, it's amazing how we can recover with food and have a patient more happy and better recover as well. So what I bring as a nutritionist, and I promote an anti-inflammatory diet to get better outcomes for you in the practice, is making higher quantity and higher quality of protein. That's mean whey isolated, hydrolyzed collagen, and lean white meats. And the mix, it's amazing when we do it. Collagen with whey protein. Fiber-rich food like pseudo cereals, and legumes and fruits and things from the nature. As well, healthy fats, omega-3, a lot of fatty fish, always wild, and antioxidants that is come in all the fruits, and you are experts doing this for IV and all the regenerative medicine. Obviously, avoiding all the food that is coming, like sugar, dairies in quantity, ultra-processed food, one kind of meats that we can talk later, and we can go more deep. So I'm trying to see and show you a clinical case that I have, and I released 2 weeks ago. It was a lady, 89 years old. She came, well, her daughter came to me because she was in a surgery with a colon cancer. And they removed the sigmoideo, and they came to me because the scar didn't heal. A few weeks after that, she started with an infection, and the scar and the healing, it couldn't happen. So they came to me, and we started doing an intervention with 30 grams of whey protein, 20 grams of peptides of collagen, 4 times cups of bone broth, homemade, vitamin C, vitamin D, and zinc. And I can say magically, but it's not magical. A week after that, we start seeing changes in his wound. And 2 months after that, it was completely closed. I saw it 2 weeks ago, and that was 6 months after that. And she's amazing. She's not receiving any treatment. And actually, she was with a chronic constipation all her life, and now it's much better. This is 3 statements that I want to show you quickly. It's the chronic low-grade inflammation. It's increasingly recognized as a factor in the etiology and progression of several mental disorders. It's like my life to show how can a nutrition can impact people who is not reacting to antidepressants. And whey peptides improve wound healing following cesarean sections in mice or in rats. And it's really important how to notice that when we use collagen, we improve the stem cells in the muscles with the whey protein together. And as well, when we use whey protein, we improve the building of collagen in the body and the structures. And cutaneous tissues regenerations as wound healing require a significantly higher level of dermal collagen biosynthesis than healthy physiological condition would. That's why we have to give more collagen than the usually dose it's put in the package. So conclusion for this, regenerative medicine needs a nutritional pillar, anti-inflammatory nutrition plus bioactive proteins. It's the key of the success, and a healing and regeneration depend of the environment we create. So the recommendation when we want to make a procedure, it's 3 months before start an anti-inflammatory diet during the surgery, for example, or the procedures, and 3 months after as minimum. It's what we want to give it to you, this recommendation. Thank you so much.